Hi everyone, I'm Jasmine, and I've been studying Chinese medicine on my own for 10 years. In today's video, I want to share a classic formula from Chinese medical classics, Shan Ma Bi Jia Tang. This formula is deeply relevant to COVID-19 fever, long COVID, and many severe inflammatory conditions. Have you ever seen patients with these symptoms? Large, bright red rashes suddenly appear on the face and body, severe sore throat, pain when swallowing, even pus or blood in saliva, dark, bluish complexion, deep bone and muscle pain all over the body. In Zhang Zhongjing, S. Jingui, Yaolu, essential prescriptions from the Golden Cabinet. These severe conditions are clearly described as yin-yang du, toxic disorders invading the blood level. My mentors have pointed out that the rashes, sore throat, and body pain described in yin-yang du match many modern severe conditions. Certain blood diseases, acute autoimmune diseases, severe viral infections, and more. Sheng, Ma Bi, Jia Tang is not just an ancient formula. It's still widely used in modern clinical practice. The diagnosis of yin-yang du is actually simple. We only focus on two key points, the rash and the throat. The most important difference is the color of the rash. 1. Yang du yang toxicity. Rash is bright red, distinct, like silk or brocade. Severe sore throat, ulcers, sometimes pus or blood. High fever, restlessness, red tongue, rapid pulse. This means toxic heat has entered deep into the blood and is forcing the blood to come outward. The rash is a sign that toxins are trying to escape. 2. Yin, du yin, toxicity. Rash is dark, bluish, dull, purple-black, not bright. Dark facial complexion, dark circles, severe body pain, bone pain, muscle pain. Sore throat is dull, not as intense. This means toxic stagnation is deeply hidden in the blood vessels. Blood circulation is blocked, and the condition is often more serious. A key point from my teacher, dark blue or purple rashes are not just cold or deficiency. They usually mean deep toxicity and blood stasis. The real wisdom of Shang Ma Bi Jia Tang is not just clearing heat. It guides deep blood level toxins outward. Let me break down the core herbs. Shang Ma seems light, ascending, draws toxins upward and outward from the blood level. Bi Jia turtle shell, salty and cold, enters the blood level, clears heat, softens lumps, releases deeply hidden toxins. Tang Gui, Angelica sinensis, nourishes and moves blood, protecting the body while clearing toxins. Gun, cow, licorice, relieves toxicity, harmonizes the formula, eases pain. Shu, Jiao Sichuan pepper, promotes circulation, helps expel toxins outward. Zhonghuang realge, strong detoxifying action, must be used carefully in tiny doses. The most critical rule, yang du, use the full formula, including Zhonghuang and Shu Jiao, strong toxins, bright rashes, high fever. We need strong herbs to break the toxicity quickly. Yin du, remove Zhonghuang and Shu Jiao. These are too warming and drying for weak patients or deeply hidden toxins. We focus on gentle clearing and guiding outward. This small difference, adding or removing to herbs, can change the outcome for severe patients. In modern clinics, my teachers use this formula for acute leukemia with high fever, rash, bleeding, idiopathic thrombocytopenic purpura, active systemic lupus erythematosus with rashes and sore throat. The names are different, but the core pattern is the same. Toxins disturbing the blood, blood not flowing normally. Important safety note about Zhonghuang realge. 1. Use extremely small doses around 0.05 to 0.1 grams. 2. Use as a fine powder, do not boil. 3. Stop once symptoms improve. Do not overuse. 4. Monitor liver, kidney function, and blood work. Yangju sounds old-fashioned, but it's sharp and practical. When you see rashes, ulcers, severe pain, and bleeding together, don't just focus on the disease name. Understand the root. Toxins have entered the blood level. Shang Ma Bi Jia Tang teaches us a powerful logic. First guide toxins out, then restore balance. That's the wisdom from Zhang Zhongjing, still saving patients today.